they say they're following the science, but it's all about behavioral science and behavioral modification and manipulation. And we're seeing that um, in Canada a lot. And Canada actually has led the way in this kind of, you know, behavioral science. They're recognized worldwide for what they did during the pandemic and how they got people to take the vaccine and their methodologies.
Over the last few years, Canadians have been told to trust the science. But who decides what that science is? And especially, who gets to define what counts as supposed misinformation? Well, today we dig into one of the most controversial government funded initiatives of the pandemic. It's called Science Up First. Joining me to discuss this is investigative researcher Regina Wattiel, who also has a PhD in statistics and therefore is a bit of a stickler for what was and wasn't making it into the science. In the process, she uncovered a web of funding, influence, and narrative control that reaches the highest levels of government. Regina breaks down a bombshell access to information response that she received, examining funding controversies in public health initiatives, how countering supposed misinformation is central to their messaging, data integrity or lack thereof, and the use of behavioral science for narrative control. All roads lead back to Science Up First and communication around how it received funding, which involved at least one Liberal-appointed senator, other government actors, their framing of anti-vax narratives, and more. Have a listen.
This initiative received over $20.7 million in federal funding, and a good portion of that was through directed, non-competing means, which basically bypassed peer review and the usual oversight. So it's a pretty substantial sum of money. Science Up First was launched in 2021, and almost immediately off the bat, they received a $1.75 million contract with Public Health Agency of Canada. And it was part of the agency's marketing strategy to combat so-called vaccine hesitancy and to increase vaccine uptake. And during this same period of time, Public Health Agency of Canada had partnerships with social media platforms such as Twitter, Facebook, Google, in order to amplify the official messaging and to suppress dissenting voices. So platforms such as Science Up First would really benefit from this amplification, since it really did, push the government's narrative. And this was set to be a one-year funding mechanism, and it was to expire in March of 2022. So just before it went to expire, that's where we see a lot of aggressive promotion by the senator and Timothy Caulfield. So what Senator Kutcher did in early 2022 is that he wrote a letter to MP Chrystia Freeland, and he CC'd high-level MPs discussing Science Up First and how he would like them to consider funding when they do their budget and requesting a meeting. So that's what Senator Kutcher did. And then at the same time, Timothy Caulfield went straight to the president of the Canadian Institute of Health Research, and he emailed the president and asked him for funds to support Science Up First. And what happened from there was very telling. So right away, you see internal emails with senior staff at CIHR, scrambling to come up with creative ways to fund Science Up First. And they even volunteered to coordinate between departments trying to get this funding. And ultimately, they decided on a directed grants process that bypassed competition, bypassed peer review, and was able to give Science Up First $1.5 million within 3 weeks of Timothy Caulfield asking for it. And this is quite unusual in many ways. So first, Canadian Institute of Health Research, their mandate generally is to fund health research, not standalone marketing and promotion, which is what Science Up First is. And second, they did this directed grants by calling it an extension of an existing grant, but there was no existing grant with CIHR. There was an existing grant with PHAC, an external agency. So they really had to, stretch or bend the rules here in order to get this money through quickly. And then, 9 months later, they were back asking for more money from CIHR. And once again, they went through the same directed grants process, bypassed peer review, and gave them another $1.5 million. And there's a lot of things that are shocking about this. For example, if you look at the process that most researchers go through, only about 13.6% of them end up receiving a grant. That's the number. And the average grant is about $216,000 a year. So these funds that were going straight to Science Up First, they're large in comparison. And in addition to that, when Timothy Caulfield first went to CIHR, the letter from Senator Kutcher was part of that whole email chain, and that's how I found that.
This misinformation dismantling platform is receiving millions in taxpayer funds almost overnight, following communication that involves Senator Stan Kutcher, a Canadian psychiatrist and professor renowned for his work in youth mental health, which is concerning given the illusion of consent and manufacturing of the narrative that has been generated through the use of behavioral science and mind control techniques these last few years. But Regina points out that the real scandal isn't just one funding request letter. It's what this funding model enables.
First of all, it gave a lot of, it empowered Science Up First to deem dissent misinformation. So they're the arbitrators, of what is right, what is wrong, what is misinformation, and what isn't. And it really did take money away from actual research into important things and give it to more of marketing, promotion, and, propaganda. And so that is very, very distressing. And this is part of a larger work that I'm working on because for the past, since the pandemic began, I've been looking at the research that's been driving the government's pandemic response. And particularly, I've been looking into the scientific claims made by the government to support vaccine mandates and passports and travel restrictions. And what is striking to me is that the evidence is very, very clear in that the government did not have the scientific justification for those measures. And it's not subtle. There's some, it's really, when I look at it, I am a statistician, but it's statistical kindergarten. It doesn't pass basic scientific rigor. And so there's really no way that you can have scientific consensus that would support such unscientific claims. So the question is, how did these claims get substantiated? And we're looking at, as you mentioned, a manufactured consensus by controlling the information and controlling the narrative. And what we see with these ATIP requests is the inner workings of how they were able to do that. That was actually part of their selling point to CIHR, that they catered to a grade 6 reading level and they used, a lot of graphics. And that really is telling because scientists, scientific facts, science is all about nuance. And these messages are so dumbed down, there is no nuance. And some of the debunking, it doesn't even make sense because it's such a broad statement that they tend to debunk, and you can't debunk certain statements without nuance, right? So, and the examples that they gave is that they debunk things like, masks are harmful. And, this is just a very odd thing to debunk. Masks are harmful without getting into any nuance, anything about, what the masks are made of, how you wear them, for what periods of time. No nuance whatsoever. Just, we debunk that masks are bad. It's almost silly.
All of this also ties back to the public funding and the spread of what Regina coined hate science in her book, Fissman's fraud, where fraudulent modeling was utilized to flip reality on its head, vilifying and demonizing the unvaccinated as super spreaders when the COVID shots failed.
Well, during the pandemic, CIHR did fund some very problematic studies. And one of the studies was the simulation study by Fissman and his colleagues out of the University of Toronto. And this study basically simulated data that was opposite to the trends we were seeing. So during the Omicron surge, we saw, and the Canadian data showed, that the unvaccinated had lower rates of COVID-19 than the vaccinated. So what Fissman and his colleagues did is they simulated data to reverse that trend, to say that it was the unvaccinated that had higher case rates and that the unvaccinated, therefore, were a disproportional risk to others. So it really fed the pandemic of the unvaccinated narrative, and they used this to justify government measures. The interesting thing here is that when I tried to get the record corrected, and I went to University of Toronto where this was taking place, and also to CIHR who was funding it, they decided not to investigate, not to correct the record. And this is extremely bad when it comes to CIHR, because during that same month that they were handing out the additional 1.5 million to Science Up First, the tri-agency presidents, that includes CIHR, NSERC, and SSHRC, they actually voted not to correct the record when it came to Fissman's work and to allow that to propagate. And that was very bad because Fissman's study was mentioned in Parliament to justify extending the travel restrictions.
It was used to say to Canadians that unvaxxed Canadians were a danger to vaccinated Canadians. It was the demonization of millions of Canadians.
The Honourable Parliamentary Secretary.
Well, Madam Speaker, the mega conservative far right is coming out. These are the anti, these are the ones that still deny the pandemic. And at the end of the day, thank goodness that the far right was marginalized back then, Madam Speaker.
So here we have CIHR funded a study that basically is misinformation. They refuse to correct the record, and yet, they are now giving money to Science Up First to combat misinformation. So you see a real double standard, and how that is problematic.
Ultimately, what all of this achieved was the illusion of consensus through a heavily crafted, manufactured narrative that Regina is trying to correct by seeking peer review for her latest paper, Unreliable Evidence, Flawed Vaccinated versus Unvaccinated Comparisons in Canada's COVID-19 Vaccine Mandates.
Well, the preprint discusses how the Canadian COVID-19 surveillance data inflates unvaccinated risks and overstates vaccine effectiveness. So, for example, we all know that when about 80% of the population was fully vaccinated and Omicron emerged, that COVID-19 cases surged to record levels. And in fact, that the vaccinated had higher case rates than the unvaccinated in early 2022. So at that time, you've seen a pivot in public health messaging and in Canadian government messaging away from the vaccine's ability to stop or curtail transmission. And instead, they focused on the claim that these vaccines reduced hospital burden. But what happened is in the early part of the first half of 2022, Public Health Ontario actually, their reports inflated COVID-19 hospitalizations for unvaccinated seniors by 1 to 2 orders of magnitude. So they overstated it by 10 to 100 times. And they knew about the instability of these estimates, but they published them anyway. And they didn't make corrections until about, summer of 2022. And by that time, their uncorrected rates were about 80 times higher than their corrected rates. And, this is highly problematic because the senior hospitalizations, they they were the ones that drove the hospitalizations for COVID-19. So that's just one example of the issues with the data. And it even gets worse with regards to the hospitalization in that during early 2022, the government of Ontario even said that over half the COVID-19 hospitalizations were incidental hospitalizations. People were there, they had COVID, but they weren't there for COVID, right? So you see that this data was very, very unreliable. And what my preprint shows out is this and many other issues with the data show that the comparisons, when you make comparisons between the vaccinated and unvaccinated, those are unreliable, and you cannot really use them to justify the vaccine mandates and the restrictions. And yet, over and over, they've continued to do that. So what my preprint does is it systematically goes through official reports, shows the magnitude of the bias, it's very, very large, and how it cannot be used to justify the government's interventions. It was known in 2021 that Public Health Agency of Canada had partnerships with X or with Twitter at the time, and Facebook and Google. And it did amplify the reach of their messaging. And Timothy Caulfield's Science Up First would have benefited from that amplification. Timothy Caulfield, when it went to CIHR, was able to use those stats, those vanity metrics to say, look, we're so successful, we should get more funding, which they received through directed funds. And then in November, when they went back for the second installment of the money, they actually, in their package, said to CIHR that the CIHR grant that they got the first time, that helped them get additional funds, another $1.75 million from Environment and Climate Change Canada and PHAC. So you see it feeding upon itself. And then from there, they have recently received $14.2 million grant to take them from 2024 to 2029. So increased funding. And of course, they've now increased it. They've now included in their mandate disinformation regarding, climate change and debunking anything that goes against the official narrative regarding mental health and climate change. What we see is if you control the narrative, you control the people, right? They're not hearing a balanced perspective. They're not hearing both sides of the story. It's particularly bad here in Canada. I don't know. People have to be aware of what's happening, right? And we need to end this kind of narrative control. We need to end this misuse of public funds. What they say they're following the science, but it's all about behavioral science and behavioral modification and manipulation. And we're seeing that in Canada a lot. And Canada actually has led the way in this kind of, behavioral science. They're recognized worldwide for what they did during the pandemic and how they got people to take the vaccine and their methodology.
As more of these details come to light, the COVID psyop doesn't simply disappear. It's just adapting and resurfacing under new causes, from climate to mental health, while ordinary Canadians are left trying to discern information from influence. With the Public Health Agency of Canada's Behavioral Science Office now embedded into the very machinery of public policy, it's no longer this abstract debate or idea. Are public institutions adequately informing citizens, or simply managing them? And do the people footing the bill for all of this have a clear view of who is shaping the science, by what means, and to what end? For Rebel News, I'm Tamara Ugolini. NoMoreShots.ca is where you need to go if you want to find credible reports dismantling this science and the illusion of consensus, the controlling of the narrative. If you would like to, you can also support this kind of journalism there and sign our petition calling for the market revocation, the novel Modified Shots, at NoMoreShots.ca.